Welcome back. My name is Dr. JP. I am a doctor of psychology, and today I'll be talking about ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a disorder characterized by a persistent pattern of at least 6 months of inattention and/or hyperactivity impulsivity. Some of the symptoms must have been present before 12 years of age, and impairment from the disorder must occur in at least 2 settings and be severe enough to interfere with functioning. Criteria for inattention are met when the person has 6 or more of the following symptoms. For adolescents and adults, at least 5 symptoms are required. Failure to pay attention to details, resulting in careless errors. Difficulty sustaining attention to tasks. Avoids tasks requiring sustained attention. Frequently loses things, for example, homework assignments. Is easily distracted and is forgetful in daily activities. The criteria for hyperactivity impulsivity are met when the person has 6 or more of the following symptoms. For adolescents and adults, at least 5 symptoms are required. Frequently fidgets or squirms, stands up when remaining seated is expected, runs or climbs excessively in inappropriate situations, has difficulty playing quietly, is constantly on the go, talks excessively, blurts out answers before questions are completed, has difficulty waiting for his or her turn, and interrupts or intrudes on others. The disorder is coded either as combined presentation, predominantly inattentive presentation, or predominantly hyperactive, impulsive presentation. Severity is coded as mild, moderate, or severe. The clinician must also specify if in partial remission in situations in which the full criteria were previously met, but fewer than full criteria have been met for the past 6 months. ADHD occurs in about 5% of children and 2.5% of adults. According to the DSM-5, ADHD is more common in males than females, with a ratio of about 2:1. Medications used in the treatment of ADHD include the stimulants Ritalin, methylphenidate, Concerta, methylphenidate, Adderall, amphetamine, and dexedrine, dextroamphetamine, and the non-stimulant Strattera, atomoxetine. Non-pharmacological interventions for children with ADHD include behavior therapy, social skills training, parenting education, and neurofeedback, formerly called EEG biofeedback. For adults with ADHD, cognitive behavioral therapy, or CBT, is an evidence-based treatment. The diagnosis of ADHD can be particularly difficult to establish prior to age 4, mainly because it is hard to distinguish normal variations in behavior from the hyperactivity associated with ADHD. The disorder tends to be relatively stable through early adolescence. In adolescence and adulthood, symptoms of motoric hyperactivity decrease, while difficulties with restlessness, inattention, poor planning, and impulsivity continue. A significant portion of children with ADHD remain impaired into adulthood. Associated features of ADHD may include low frustration tolerance, irritability, or mood liability, as well as social rejection and interpersonal conflict. Academic achievement and/or work performance is often impaired. When the diagnosis is ADHD combined presentation, there is frequently a comorbid oppositional defiant disorder, about 50% of the time, or conduct disorder, about 25% of the time. Most children with disruptive mood dysregulation disorder have ADHD, although most children with ADHD do not have disruptive mood dysregulation disorder. Specific learning disorder also commonly occurs with ADHD. Other disorders that occur in individuals with ADHD at higher rates than in the general population include anxiety disorders, major depressive disorder, and substance use disorder. Co-occurring disorders also include antisocial and other personality disorders, obsessive-compulsive disorder, tic disorder, and autism spectrum disorder. By early adulthood, ADHD is associated with an increased risk of suicide, especially when comorbid with a mood, conduct, or substance use disorder. Thanks for watching. If you'd like to see more videos about ADHD, like, comment, and subscribe for more.